Hey ho, let's go. All right, this this is not 102.3. Hello, my name is Dr. MarkAlain Dery, Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana. I live in New Orleans, Louisiana, and I serve as co-chair for the ACOI Infectious Diseases Subspecialty Section. You've seen me do these updates now for almost a year, and in conjunction with the leadership of the ACOI. Hello, leadership. Thank you for letting me do this. I hope these messages are helping you keep up with the latest of COVID-19. I know that many of you are in the thick of the fight, and I'd like to thank all of you on behalf of all of us who focus on infectious diseases daily for a living, and certainly, again, on behalf of the ACOI. Hello, ACOI. So moving together with the ACOI, we'll continue to share information as it becomes available, as well as some of the hopeful progresses that we are seeing. Today, a little bit less on the hopeful and a little bit more on the these are some hard stories, but we're here to report what we're seeing, and I think the stories that are the most important stories that are going to keep you in terms of cutting edge information. So let's talk about this new virus recombination. I think this is one of the most important stories of the week. In the old days, there was a gold rush, right? And the discovery of those nuggets in the Sierra Nevada were important because people got rich. Well, but today this is different because there's a new California discovery that's not so glitzy and not so glamorous. Two variants from the SARS-CoV-2 coronavirus that caused COVID-19 have combined their genomes to form a heavily mutated hybrid version of the virus, and it was discovered in California. This is called a recombination event, and I'll explain that in a moment. And there are those that are provoking warnings that pose us to potentially enter a new phase of the pandemic. Let's see. The virus sample that was discovered in the LA area is a hybrid that's essentially a mix of the 117, the B117 variant that you'll remember emerged out of the UK, and a new one that emerged out of California that is now being referred to as B1429, and that emerged out of California. This was found and reported out of Los Alamos National Laboratory in New Mexico. So again, unlike a regular mutation where changes accumulate one at a time, and that's how we got variants like B117 and 1351 and P1. The opposite here is the case with recombination, because what recombination does is it brings together multiple mutations all at one go. And most of the time, these don't even confer advantage to the virus, but every once in a while they do. Recombination can be of major evolutionary importance, and it is considered by many as to how SARS-CoV-2 first originated. Now, if this is confirmed, the recombinant would be the first to be detected in this pandemic. Recombination commonly occurs in coronaviruses because the enzyme that replicates the genome is prone to slipping off the RNA, which is kind of funny when I think about it, and I don't mean to be laughing because this is serious, but I'm just thinking of an enzyme that just keeps slipping off of an RNA, but it does. It slips off the RNA strand, and then it rejoins it where it left off. But if a host cell has two different coronaviruses, and the enzyme slips off of one strand, and then what happens if it jumps onto the other coronavirus strand that may be nearby? You can have combining different elements of each genome to create this hybrid virus. So this recent emergence of multiple variants of the new coronavirus may have created raw material for recombination, because people now are infected with two different variants at once. And the implication of this findings, as I said, aren't clear because very little is known about the recombinant's biology. However, it does carry mutation from 117, as I said, as well as 1429. Now, 117 is more infectious, 1429 also infectious, but also confers resistance to antibodies. And this kind of event could allow the virus to have coupled a more infectious virus with a more resistant one. So we don't know yet. We will continue to watch this, and I will assure you that I will continue to follow this story very carefully. Okay, I think probably the other very big important stories that are happening right now is what's happening in Texas. So to all of you in Texas, much love, much peace. I know it's very, very cold there, and that weather in Texas is of concern. And the point of this story is not so much the cold weather as much as it is that the gathering of individuals that are happening in Florida right now, and what we saw about a week and a half ago in Florida, could potentially portend to some super spreading events, and that's what we're going to talk about next. Now, between the Super Bowl gatherings and the resulting victory parties, and now the weather emergency in Texas, both of these southern states are primed for COVID-19 super spreading. And again, just to remind you that we talked about, I'm almost positive I talked about it here, that B117 is a very, of all the states, Florida has the highest prevalence of B117. So we saw that massless fans gathered for the Super Bowl a few weeks ago. Of course, they were at home parties and bars, on the streets, and afterwards parades. Officials defended the parade, saying it was outside, so it was safe. Don't buy that logic. It's not true. When people are crammed together, they transmit virus. And I can reference Mardi Gras 2020, which we saw one case led to 800 cases in New Orleans, which led to 50,000 cases across the South. So we recognize that is a potential issue. Florida last fall saw a similar situation in September where they had a lightning parade, which was believed to have sparked, get it, lightning, sparked, sharp increases in a small town where the parade was held. But that community parade doesn't hold a candle to the number of people who were at the Super Bowl and related events, which was the biggest gathering in the Tampa area since the beginning of the pandemic. And if you saw those images of those events, it's disturbing, especially in lens of public health. But now let's talk about Texas. The ice storms and the cold that Texas is being hit with is exposing weaknesses in the Texas power grid. Texas relies on a free market principle where it allows power companies to charge as they wish when the demand for power increases. But as Slate magazine says, human well-being isn't in an economy, and it shouldn't be run as such, not ever, especially not when climate change is causing drastic shifts in global weather patterns. But this is having real public health consequences. The tally thus far is at least 2 people suffering from homelessness have died from cold. A woman and child died from carbon monoxide poisoning after running their car in the garage to stay warm after losing power. That one really breaks my heart. All of these break my heart. Someone watched their loved one's oxygen machine battery run out. Can you imagine that? A family burned their belongings so their children wouldn't wake up cold. Food is running out of grocery stores. One woman reported her 80-year-old grandmother slept in her car to keep warm because she didn't want to risk catching COVID-19 by staying with her family. Water pipes are bursting, causing homes and hospitals to flood and roofs to cave in. Think about this in terms of public health implications. In the middle of a pandemic, people can't wash their hands. Hospitals are already overrun with COVID. Now people have frostbite, carbon monoxide poisoning, car accidents from ice on the roads. Plus, hospitals in Austin are having to transfer patients because they have no water. Oh my goodness. Think about that. My heart goes out to my colleagues in healthcare who are being hit with this one thing after another, and now no water. Have you thought about what this means for vaccine distribution? Harris County, Houston's county is trying to administer close to 8,500 doses of the Moderna vaccine after a backup generator failed. The freezer holding the vaccines no longer is keeping them cold at the right temperature. And ironic, cold weather has knocked out the power to keep the virus cold. And let's not forget the super spreading event that is happening due to people huddling together. staying with other households and family and friends, breaking their bubbles. This is a nightmare on all fronts, and I think that between what we've seen in Florida and what we're seeing now, I think come April or May, we're going to look back and see that these events were sparks, if you will, or these were super spreading events that is going to lead to a new uptick of cases. Even though we're on the downswing right now, how can I say that? Even though we're on the downswing right now, we're going to see an upswing likely soon, and these may be the events that may get us there. So in the interim, please stay on the lookout for our regular updates. And to read more from the sources used in this report, please go to acoi.org/COVID-19. Together with the ACOI, we'll help you have the latest information to help you respond to your patients and stay on top of the crisis. As always, please feel free to reach out to me at madery@mac.com. Please stay safe. I know that we can do this together.